When a person loses hair, 97% there's a family history of hair loss, a gene in the family. And if you inherit that gene, you lose hair. Hair loss is in the front and the center of the head. Nobody loses on the back of the head. This hair is permanent. Because the hair at the back of the head is permanent, if I take hair from there and plant it anywhere, on the head, forehead, nose, cheek, eyebrow, moustache, anywhere, it will stay for life. And grow like normal hair, need haircuts, never fall. You can comb them, oil them, shampoo them. They will stay for life. This is the scientific basis of hair transplant surgery. Operation of hair transplant is under local anesthesia. We give you some injections, make the area numb and do the surgery. It takes 4 to 6 hours. A team of 4 to 6 people work together. Throughout the operation, you're awake. You're listening to music, watching television, and you go home immediately after the operation. There's no staying in the hospital. Only 2 medicines work in hair loss, which can slow down hair loss, control hair loss, but they don't grow new hair. These medicines have a few limitations. They work in 70%, don't work in 30%. They work when your hair roots are there. Once the hair roots have gone, they don't work. They work when you're in the back, they don't work in the front and the sides. And most importantly, the medicines control hair loss. So when hair loss is stopped by using medication, you have to continue using medication. You stop the medication, the hair will fall again. Anyhow, first line of treatment for any problem is always medication. But in patients who use medicines for 6 months with no result, who do not have hair roots, or who have lost hair in the front and the sides, the only option is doing a hair transplant. What we do in a hair transplant? Take permanent hair from the back and transplant them to the areas you don't have hair. There are 2 different techniques of taking hair from the back. One is called the strip technique or FUT, one is called FUE. I do both the techniques. I'll explain both to you. The way for transplanting hair in the front is the same in both the techniques. The commonest technique all over the world, 67.5%, is the strip technique or follicular unit transplantation. What we do here is take a strip from the back of hair, including the hair roots, about 1 to 1.5 centimeter wide. So if I take a strip from here about 1.5 centimeter wide, what will happen? There will be a gap, there will be a wound, there will be a raw area. If I stitch it up, there will only be a line, there will be no gap left. So when I take out the strip and stitch up, immediately there is no gap. The line is covered the rest of the hair. Nobody knows from there the hair has been taken. This strip a lot of hair. Under a microscope using loops, magnification, we cut out the hair individually with these roots to get numerous follicles. Depending on the number of follicles I've got, I'll make small gaps in the areas you don't have hair and then plant them one at a time into each gap. Once I place them all in, I'll send you home. The hair we transplant are small, 3-4 millimeter in size. Any hair in our scalp is a cycle. It grows for 2 to 4 years, falls off one day, the roots remain, they take rest for 2 months and they grow again. Because the hair have been moved from the back to the front, the outer part normally falls off in the next 2-3 weeks. But the roots remain, they take rest for 2 months and they grow 3 months from date of surgery. Hair grow at the rate of 1 centimeter a month. The hair we keep are 3, 4, 5 centimeter long, so another 3, 4, 5 months. So 6 to 9 months from the date of operation, when the transplanted hair have grown equal to the existing hair, you can appreciate the result of a hair transplant. The other technique of FUE, 32.2% surgery is done by FUE or follicular unit extraction. It's a good technique for a small area, but has limitations for a large area. What we do in FUE? We cut the hair short, all around we cut the hair very short. So here's the hair sticking out of the scalp. Then I take a punch, I go straight through and try and pull out the hair with this root. Because it's a blind technique, I cannot see below the skin. If the 2-degree mistake angle will cut the hair root. So in the best of hands, there's a loss of 10 to 30% in FUE. In strip, because I'm seeing and cutting under a microscope or a loop, magnified view, the loss is only 1 to 3%. Secondly, in FUE, if I take out this follicle, I cannot take out the next 2. If I take out this, I cannot take out the next 2. If I take out 2 adjacent follicles, there's a bald patch. Strip, I can take out all. So in strip in one sitting, I get 3, 4, 5, 6, 7, 7,500 Harsha Bhogle in one shot. But FUE, you will not get more than 2.5, 3, maximum 3,500 follicles. Thirdly, in strip, in FUE, you have to shave your head. Shave the back, shave everything. India, nobody shaves unless they're tragedy in the family. People ask you, why have you shaved? Strip, no shaving. When you go out, nobody knows from the hair been taken. In FUE, it will take 3 months for the hair to grow back. It's a telltale sign you've done something. Fourthly, the scarring in FUE is much more than in strip. What I advise is wrong. In strip there's a fine line. There's a special technique called trichophytic closure. Hair grow through the scar. You don't see the scar unless you shave your head. When you shave your head, you'll see a fine line. In FUE, when you shave your head, and I've done 2000 punches, you'll see 2000 dots like a Chinese checkerboard. 2000 dots is much more than one fine line. The last big important problem of FUE, for some unknown reason, probably because of damage of stem cells or something else, the transplanted hair fall off after 2, 3, 4 years. In fact, a guy like Vrinder Sehwag got a hair transplant done in 2009 and he lost 70% of his transplanted hair in 2012. Strip, they don't fall. I did Shastri's hair transplant in 2006, Arun Lal 2007, Lalchand Rajput 2008, Harsha Bhogle 2008. They still have all their transplanted hair. Sehwag got it in 2009, by 2012, he lost 70% of his hair. The surgery, again I repeat, is on the scalp, outside the skull bone. The brain is inside the skull bone. There are no side effects. And these hair are permanent, they'll never fall. I have done more than 6,000 hair transplants till now, including 900 FUEs, and in 600 women, 600 female patients. People have come here for a hair transplant, include what I mentioned, Shastri, Harsha Bhogle, Arun Lal, Lalchand Rajput, Brijesh Patel, Lachman, Yusuf Pathan, Irfan Pathan, many others, many film stars as well, I can't name them. To do a surgery or do a blood test, you can do it anywhere, you can even do it here. Make a deposit, we'll give you a date for surgery, then you will come, do the surgery, pay the rest of the money and go home. Transplant original hair, nobody can make a difference, not even a barber. They grow in the same way, same direction, same rate. You can comb them, oil them, shampoo them, style them, dye them, streak them, gel them. You can have a haircut. Even you can shave them, they'll come back because they're their own original hair. So don't have to remain bald and look with that aged look. Come and get for your youthful looks back again.